consultant, which I teach people how to open up their elimination channels to get the nutrition in, and it's a do-it-yourself kit. So I just teach you things that you can integrate into your lifestyle so then you don't end up with a big C word as far as cancer or any of the chronic diseases that, that occur when you are trashing your body for 10, 20, 30 years and not doing anything to help the body get rid of the stuff that you're putting in there. So it stays stuck and creates cancer and different diseases. Chronic diseases are very easy to treat. It's just lifestyle changes. I also do myotherapy, and I haven't really spoken about myotherapy too much, so I'm going to just show you what a myotherapy session looks like and the difference between massage and myotherapy. There's a huge difference. I'm basically a teacher, so I was calling my clients or whatever patients, but I'm not going to call them that anymore because I don't even want that word. The reason is because I want people to be proactive in their health care, so they are students. They are learning about what to do for themselves. So myo means muscle, and therapy means to heal. And what I do is I work with trigger points, and trigger points, if you're not familiar with them, is what they inject when they're doing steroid injections or in order to get rid of people's acute pain. It works temporarily, but they only can work with like 1 or 2 trigger points at a time. What I do is I average about 75 trigger points in a session. And the trigger points are important because trigger points are sore spots that get stuck in your muscles when you overuse or injure a muscle. Then they lay latent in your system until you become physically or emotionally stressed. And when that occurs, the trigger point fires and sends a message to the brain. The brain is always protecting the body, so it sends a signal to spasm. So a pain spasm cycle starts. And typically what people do when they get into that pain spasm cycle, they have a headache or their back goes out, it's actually in spasm, not out, is they go to the medicine cabinet or they go to somebody and depend on them to readjust them or whatever. That's not being really independent in your own health care, and they just hang for 3 days until it goes away or until the trigger point simmers back down to a latent or sleeping state. But it will fire again under physical or emotional stress. So what you want to do is get rid of the source of the pain, which is the trigger point. So muscles have memory, so they also forget. So there's a couple things that this is an active therapy for the patient or the student and the therapist. It's not passive where you just lay on the table, get work done, and go. You learn a lot. It's all interactive. So what once you get rid of the trigger point, the muscles will want to go back into that shortened spasm state because they forget that they think that's normal because it's been in that state for so many years, months, or whatever. So you have to re-educate it. And how you re-educate the muscle is repetition's the mother of skill for human beings, and so it is for muscles too. So I work on the trigger point, and what I do is I use a ischemic compression, which is you go in slow into the muscle tissue, you hold for 7 seconds, and you release slowly. And then you move on to the next trigger point. And then I give you passive stretches that I integrate in the session depending on what I figure out. I play detective on your body because I take a history first on what you've been up to with your body. Your sports, your accidents, your operations, your hobbies, occupations, all that lay down the trigger points. So that helps me because you might have a pain in your hip, but it might be coming from your shoulder. And so I determine that as I'm working on you and through the history. So once I determine that, I lay you down. I don't use oils. It's clothes on. I don't really like to work on jeans because it's extra work for me. So I ask you to wear like sweats or shorts or t-shirts, something where you can move in and it's easy for me to work on. And is anyone interested in coming up to help me demonstrate this? Go ahead. You want to come?
Yeah.
Do you have any kind of certain pain or anything?
Oh yeah, a lot.
No.
Boxing, wrestling, motorcycling.
Okay. So what I'm going to do, I'm going to have you sit here for a second just until I can explain to you and to the audience what I'm going to do. So what I do, I'm going after the trigger point. So I use my elbows, my knuckles, and my thumbs. Trigger points are sensitive spots, and muscles come in layers. So here's the layers of the muscle. If the trigger point's in the top muscle, it's not going to take too much pressure. If it's in a lower muscle, it's going to take more pressure. And that's where the active comes in. He's going to tell me on a scale of 1 to 3, 1 being pressure, he's not feeling anything, 2 feeling a sensation. It feels sharp, hot, could hurt so good, or it feels like dropping a pebble in water, how it rings out. But the sensation's okay, it doesn't make you tense up. 3, if your other muscles start to tense up, that's an indication that it's too much pressure. And that defeats the purpose because it lights up other trigger points and puts them into the pain spasm cycle, and we don't want to do that. So no pain, no gain is out the window. It's about good feedback, feeling the trigger point, and I hold it for 7 seconds, and then go on to the next one, and then he might be more sensitive in one area than the other. That just means that muscle tissue has more trigger points in it. So once you get the trigger points out of there, you do the passive stretches to re-educate the muscles. Then you're 80% pain-free or all the way, depending on your you cooperating as a student, doing the exercises, because you do them throughout the day, meaning 4 times a day. They take 1 or 2 minutes to do them. The hardest part about doing them is to remember to do them. I gave myself a set of exercises, and I'm like, oh my God, I forgot to do my exercises. So I eased up on my students a little bit. But what I do is I ask people to attach it to breakfast, lunch, dinner, when you go to bed. Something that you do that can remind you until you can get integrated into your lifestyle. But you only have to do that temporarily, because after the pain is gone, you don't have to do them 4 times a day. But you now have the tools, because I teach you, I give you charts on how, here's the exercises in visual, and here's the charts on how to do myotherapy yourself. And on the 3rd session, it's between 3 and 6 sessions on the average. Doesn't have to be that way. It just depends on how motivated you are. I put the chart right under the table, and you follow along as I'm working on you. Then I highlight where your specific injuries or pain is occurring. There's arm charts and neck charts. Headaches are really easy to get rid of because they usually start in the back of the neck and settle in somewhere here. Here's the the 2 tools that you use for myotherapy. This is a little wooden dowel, and this is a crook. And what you do is you lean it up against the wall, and you can work on yourself like this, and then you work up your back, and then you can't reach anymore. And that's where this comes in. You bring it in, and it's leverage. It's not about forcing it, it's about using it as a tool with leverage. And that gets on the trigger point. And you can play with it and put it in different areas. And if you need more pressure, you put it in a corner like this, and you lean into it. So as your muscles get better, you're going to take more and more pressure. So between these 2 tools and the charts, you can take care of your own muscular pain, if you're motivated to do so. For me, it's helped me quite a bit. I'm pretty hard on my body. I live a life of living life, and it's wonderful to have a tool when I go, uh-oh. So what I'd like you to do is lie face down. Now you're wearing jeans, which is, I'd have you put sweat, go ahead. I'm okay. I'd have you put sweats on if you were in my office, and then I'd also, I'm going to roll this up underneath your ankles. Okay? Okay, so on a scale of 1 to 3, 1 is you don't feel anything, just pressure, 2 is a sensation, and 3 is pain. And you can just let me know by saying 1, 2, or 3. So I start on the opposite side of the body because I use leverage and gravity. Massage is a lot more work than myotherapy. So what I do is I have it relaxed. I start in this pants pocket because all the upper body muscles attach here and all the lower body muscles attach here. So if I'm working on finger pain or arm pain, these major muscles, if I just worked on his arm, these major muscles will pull it back out again. So you got to get the big guys before you can go in for the small muscles. So what I do is I just go in slowly, and I go slow to give him a chance to give me feedback.
1.
Okay. And then I hold for 7 seconds. Now it can go from a 2 to a 3 because it could activate the trigger point. If that happens, just let me know by saying 3 and I will let off. So if he says a 1, I'll press harder. If he says a 3, I will let off. And a 2 is what I'm looking for.
1.
and then I need the muscle in between. And I never press on the spine because I'm not working on the spine. I'm working on the muscle tissues that are pulling on the spine. People will have pain in their spine and their back. It's their muscles yanking on the bones, the joints. So if you get these muscles back to their normal resting state, then they don't pull on those joints in spine, and our basically muscles are stronger than bones. When we get typically treated for a broken bone, the muscles aren't treated. The bone's usually set, and then you're on your way. But that's all laying down trigger points because you're carrying around a cast and you're. So this gives you an idea of what a myotherapy session would be like, and I would just go up his spine or down his legs depending on what his history tells me. And then on the second session, you'll be doing exercises, and I'll ask him what he liked, what he didn't like, what felt, what didn't. Never forcing the exercises at all, because it's about re-educating the muscles and letting them know where they're supposed to be, not forcing them to do it. So what I would like to do, if you can, get on your hands and knees, and I'm going to show you an exercise.
It's called begging. I've done it before. Please don't.
What you do is you're going to get on your hands and knees, put your hands directly underneath your shoulders, your knees directly underneath your hips, and you're going to come down, put your ear down towards the ground like this. If you can't help it, let me show you first, and then you're going to come up like this. Now, if you're not able to go all the way down, just go where you're able to go, and then all the way up. So these exercises you should be able to do without feeling any kind of stretch or strain. And if you do have any kind of stretch or strain, that means that your muscles are tight. So go ahead and looking at your hand all the way. Good, go slow. Just a couple more. So what I do is I'll have them do 4 on each side, and I teach you how to do this standing up too. If it's inconvenience because your occupation, like a bank teller, can't exactly get on their hands and knees and do exercises, I teach them how to do it standing up on your break or whatever. So see the idea? Now this is an all-around advanced exercise. Does that feel okay? Okay, go ahead and see, and that's the kind of stuff I would know. Go ahead and stand it into the table with your legs hanging over the side.
Like this?
Yeah. So if you want for volunteering, I will give you a complimentary session, okay?
Oh, nice. Yeah.
So anyway, that's just sort of an example on what myotherapy does. Getting rid of the trigger point, that pain spasm cycle, and re-educating muscles. And taking your own health care in your hands is really the beautiful part about alternative practitioners. All we are really are teachers. We're really not anything but that. And we really want to give our information out, because for me, watching people being traumatized with pain and suffering and getting diagnosed with these disastrous diseases like heart attacks. 99% of them are caused by arterial blockages from cholesterol. Our body makes our own cholesterol. We don't need any more cholesterol. Where do we get the cholesterol? Animal food. So as long as you're eating animals, you are building a plaque and crap in your block, in your arteries, and then you end up having a heart attack. And it's so preventable. It's just at the end of your fork. You just have to change what's at the end of your fork. But that's hard to do. And it's not about it's just about taking your meat and making it smaller, and your side dishes and making them bigger. That's what they do in countries that eat meat, but they don't have a high heart attack rate. We have a little bit of a problem of excess. We have an excess problem in this country, and it's killing us. So anyway, if we can access that we are all here to integrate and help each other, and we can learn from each other, and alternative practitioners are just here just for that, it can really rock the world. So does anybody have any questions at all? All right, well then, is my time up or? Yes. All right, thank you so much.